Good afternoon. We're going to get started. We know time is limited, so grab a seat. We are not going to be playing guitar, but that was lovely. I hope you had a lovely lunch and engagement with Stephen Page. That was really, really nice. So welcome to just name our session so you can decide if you're still in the right place. Collaborative Action to Preventing and Ending Youth Homelessness. We're going to do a little bit different today. So we have two full presentations. We've lumped two together. So first up for you, did you all go to a session this morning? Anyway, we'll do Q&A after each one. I'll be your timer, moderator. So you're all adults. If you need to get up at any time, please do what you need to do. I do want to welcome you to Montreal and this territory. I hope that you do take some time to recognize the land that you're on, as well as your own land and how you were brought to this place today. So deep breath, shoulders down as we begin. We're going to start with our, now I lost that's the worst. I know, it's so organized. This is picking up everything I'm saying, isn't it? That's good. We still got people coming in, so we're all set. We're going to start with our lovely Daria Ellen Ebanon she's the Executive Director at Family and Children's Services of Guelph, as well as the CEO of Kindle Communities, and Kristen Kearney, Executive Director of Wyndham House. So they're going to kick us off.
Hi, everyone. Thanks for joining us after lunch. Hopefully we don't put you to sleep. We'll try our best. I'll bring Daria up, and we'll just both introduce ourselves. So as Tanya said, I'm Kristen Kearney. I'm the Executive Director at Wyndham House in Guelph, and Wyndham House is a youth-serving organization that provides housing and homelessness supports, wraparound well-being supports, and education programs for young people.
And I'm Daria Allen Ebron. I'm the Executive Director of Family and Children's Services of Guelph and Wellington. And Family and Children's Services is the child welfare serving organization in the Guelph and Wellington area. And I'm also the CEO for Kindle Communities. And Kindle Communities is a nonprofit developer and landlord. We own a couple of properties in Guelph, and we are a socially responsible landlord in that we rent those properties for below market rent. And our most recent project that we opened a year ago was a permanent supportive housing building for 32 individuals in our community. So I'm going to kind of kick us off here. It is a real pleasure to be with all of you. I was going to say this morning, but I guess it's the afternoon, right? And after lunch, you either are feeling incredibly inspired and excited and energized with all that food that you got, or you're feeling incredibly sleepy. So we're going to hope for incredibly energized and inspired so that you can share some of your energy with us. So Kristen and I have been working together for the last several years, and the relationship between Family and Children's Services and Wyndham House is long and well established. Why this works and has worked for so many years is because we do share a common set of values and principles in terms of the way that we carry out our work. And so, I have to click in two places. This could be hard. So why would a youth-serving organization serving young people who are experiencing homelessness partner with a child welfare organization and an organization like Kindle? Through the conversations, and sometimes people will ask me, like, did this happen at a planning table? Were you in a work group together? How did these ideas and synergies come to be? And really, it was just through relationship and conversation. And in the conversations that Kristen and I have been having over the last couple of years, we really recognized and acknowledged that both our sectors are experiencing a certain amount of crisis as a sector. In child welfare, we know that when youth come into our care and there's not adequate housing, that we really become, there's high costs, there's high accountability attached to that, and we oftentimes become the pipeline to homelessness for young people, which are not the outcomes that as a system we are trying to produce. We also know that the people that we serve in our systems have often experienced intergenerational trauma. Often their families have been part of the systems that we represent. And what that means is that chronic homelessness is not an individual issue, but it's really a systems issue. And so when Kristen and I have been having these conversations, instead of admiring the problem and talking about how much things are broken, because sometimes we can really get caught in what's broken in our systems, we started to talk about where we have alignment and where we might be able to find solutions. So coincidentally, we were both doing our strategic plans at about the same time. And when we looked at our mission and our vision and our values and the purpose with which we engage with our leadership and try to serve the children, the youth, the families in our community, we realized that we had a lot of overlapping alignment in our plans. We're both very committed to early help and prevention, knowing that the sooner that we can help individuals and families, the less likelihood that difficulties and problems will become chronic, and that we can connect families to their natural supports and networks early on. And we were both very committed to upstream approaches that would have long-term impacts at a systems level in terms of the interventions and solutions that we look for. And we really are committed to improving the well-being of our youth with this fundamental belief that young people are our future and that an investment in our young people will make a better world for everyone into the future. So I think that's you, my friend.
Okay, so after lunch poll, how many people in the room work specifically in a homelessness serving sector or organization? Okay, so most people in the room. Because we're about to get policy nerdy. How many people are policy nerds? Yeah, I know Darren's a policy nerd, so yeah. Oh, yeah, I see another policy nerd back there. So yeah, we're going to get a little bit nerdy, so I just wanted to clarify how many people are coming from that homelessness vantage point versus maybe a child welfare or another sectoral vantage point. So when Daria and I started thinking about how we work together, we know that we have a lot of the same problems right now. We're seeing young people struggling a lot. We're seeing increasing complexity, and you might hear that a lot in your community too, whatever that means. It's something that we're saying a lot right now. We know we have a housing crisis, which means that we don't have safe places for people to go, and the right kinds of places at the right time when people need it. But we really wanted to dig into kind of where there are also overlaps that we can take advantage of from a policy perspective. Where are there kind of not just synergies in our own values and organizational context, but also at a system and at a policy level. And so many of you are very familiar then with what we're trying to do in youth homelessness. We're trying to move towards prevention-based models. We don't want young people to come into homelessness in the first place. We know that we, in the past perhaps have not focused enough on prevention as our kind of primary focus, and too many young people have ended up in chronic homelessness and with worse outcomes. In the child welfare system, there's a very similar dynamic. In child welfare, there's a recognition of the harmful colonial history of that system, a recognition that bringing young people into care is not resulting in good outcomes for the young people that are coming into care. And as Daria said, I've heard it, stated in this way that child welfare can be a super highway to homelessness. And so we know that from both perspectives, that there's this kind of dynamic of wanting to go upstream. How do we look at this problem differently? And instead of focusing on just bringing people in, how do we prevent them from coming in the first place? But also thinking about complexity and how we're supporting young people and their families where there is a lot of complexity, where we know they are coming into homelessness, where they do have care needs, where prevention models that we have right now aren't necessarily kind of working to prevent those young people. How are we wrapping around them to improve the outcomes that they're experiencing? And so that's also some of the principles of child welfare redesign. So they're really thinking about permanency. So how do we create situations where young people have kind of permanent plans, permanent supports in their lives? What model does that sound like from a youth homelessness standpoint? Anyone? What's a common youth homelessness model right now that we're trying to? Maybe also housing first, but family and natural supports. Yeah, so there's a focus on thinking about how do we bring families in and look at the needs of the whole family and not just that young person. There's a focus on early help. So what's happening when people are getting referred to child welfare? Are they getting the supports they need, or are they just ending up in the system of child welfare? There's also a focus on quality care. And so when we think about complexity and young people with a lot of co-occurring needs, or young people where they are going to be kind of living in care or living in our system outside of a family context, there's a focus that we need to do better to improve the outcomes for those young people. And so there's something also called the Quality Standards Framework, and that's a policy document that is informing work in child welfare right now, and it's all about thinking about youth voice and choice, program design models, and how they are built in a way that meets the needs of young people and has a standard of care for young people, so that we don't see young people that are in child welfare that are not graduating high school, that are ending up homeless, that don't have income security, things like that. So as you can see, there's actually a lot of synergy, even though I think a lot of this work, unfortunately, has happened in silos. There's sort of, both systems are coming to a lot of similar conclusions. So in terms of that policy context, then, these are some of the priorities in both of those systems. So there's really this focus on how do we do prevention in child welfare, while still maintaining the safety of young people that are in that system. Thinking about, again, creating permanency, lifelong connections, and in child welfare that's often talked about, things like kin care would be an example of how they talk about that. So making sure young people are connected to their families and their culture and their communities. As well as kind of their developmental well-being and increasing support. And then there's also thinking that's similar to what we talk a lot about in the homelessness world as kind of continuous improvement and quality. They're thinking about efficiency. They're thinking about how to do intersectoral collaboration to meet young people's needs. And then in our system, obviously, there's this significant shift to thinking about how do we do prevention better, how do we coordinate with other systems so that we can provide more appropriate upstream intervention, how do we address complex needs, and we know we need to do better about family and natural supports, but how do we do that more effectively? So these are all the things that Daria and I talk about, and you'll hear about some examples of how we're trying to do those things in a different way. But I also, before we continue with some more specific examples, wanted to talk about some of the constraints that we face, because I think that's often where things break down. And I wonder if there's some people in the room, if you work at a similar organization as mine, you might be thinking, well, I have a lot of tension with the child welfare agency that I work with in my community. It's actually not going very well right now. We often are kind of having conflict or challenges around common cases of young people we're serving, or they don't talk to us at all. And I just want to be clear that we have some of those problems too. And we hear from our staff sometimes that there are tensions. Like, one example would be the voluntary youth service agreement model for 16 and 17-year-olds. There's a bit of pressure, I think, in the child welfare system around how we're serving that population differently, but there can be tensions around how that policy is getting applied in different contexts, and we might have kind of competing demands or competing goals. So an example would be, maybe we have a young person that comes into our shelter and we think that they are in need of service, and we're trying to refer them to child welfare, and child welfare thinks that that young person has safety at home and can go home, or has an aunt that they can stay with in a different city. And so then there becomes this tension about what is the best interest of this young person in terms of the kind of directives that we're each receiving as sectors in terms of how to help that young person. So those tensions are real, and how we've really overcome them, I think, is by having a strong relationship. As Daria said, it is the foundation of everything. Talking to each other a lot. Trying to understand what are the pressures in each system and how do they impact the way that our staff are interacting with each other. How do we help our staff, and how do we as leaders understand some of those complexities in a deep way so that we can find better solutions.
I think that we probably could do a whole session on relationship and connection and the things we talk about and what's worked well and what hasn't worked well in terms of that collaboration and connection. But just to build on Kristen's points, I think what stands out for me is always this collective commitment to our purpose, this collective commitment to humans. And I've worked in systems before where there's been competition for resources, but I think our approach and the way we come together on things is that if the resources come into the community and we can do things and design things to change and to create solutions that work for people, then that should continue to be our focus. So we haven't had any arm wrestles yet. You all might want to see that though. How many of you have worked with youth? How many of you have worked with families? How many of you have worked with little kiddies? So you'll know that this slide looks very linear: early help, transitional support, complex care. But we know in the work that we do with children and with youth and with families, it doesn't always happen that way. And so has anybody here ever had an experience where you see someone when they're 10 or 12 and it's earlier on in their journey, and then you see them when they're 15? Yes, anybody? Yes. Okay. So, and when you hear about how this relationship and the solutions that we've developed have evolved, what you'll notice is as much as we talk about early help and prevention, is that we actually started with transitional supports in terms of our connection with one another most recently. So as a child welfare organization, we try really hard to help families as soon as possible, to connect them to resources, to have involvement with community, to keep them at home with their families, and when they can't be with their families, to keep them with kin. Because we know the more disconnected kids get from their culture and their traditions and their community, the more challenges that they have as they grow up into adulthood. We also know that despite our best efforts, kids do still come into our care sometimes. It's a lot less than it was historically. However, it still happens. And a subset of those kids have really important, difficult, and complex challenges attached to the things that they're dealing with. And what communities are facing and what we're facing in Guelph is that there are not a lot of local options. We've seen a decrease across the province in our foster caregivers, and we're often left searching out alternative options or outside paid resources to manage the care of these kids, which adds to that disconnection from community and from culture that I mentioned earlier. So our goal is to keep those kids more local. Our goal is to think about the importance of housing first. Our goal is to make sure kids are connected to community. And then we also know that despite best efforts, there are some kids that grow up in our care. And oftentimes those kids end up or are being serviced and supported by Wyndham House. And when kids reach 18 and between 18 and 23, child welfare organizations continue to support them. However, we are preparing them for the success of launching into adulthood. And so that's really where we started in terms of the solutions that we looked at. So we're looking at the continuum of solutions in the work that we're doing. So we started with this program called Flanders. I mentioned to you earlier on that I'm also overseeing an organization called Kindle Communities and that we own property. So Kindle and Family and Children's Services and Wyndham House came together to develop a solution for transitional aged youth and building on programs that have already been long-standing at Wyndham House. So Kindle provided the property, Wyndham House provided the services, and we provided the supports that were necessary in order for that program to exist, and so that the kids in that program would have the necessary supports that they needed. So use of existing housing stock, integrated child welfare solutions, funding, support. We freed up capacity for staff in terms of the resources that we were providing, and this really aligned with the work and the expectations around accountability for child welfare.
Okay, great. Yeah, and part of what that Flanders program did is because we have a limited supply, as probably everyone does, of supportive housing stock, having a sort of less acute, less intensive option for young people who were moving towards independence allowed us to move some young people into that setting to free up spaces of supportive housing for other young people. And I think the reason that we were really excited about that is because we did not need any new resources to stand it up. So we used child welfare funding, We used existing staffing, we used a house that Kindle had, and so there are kind of these opportunities when you look at these intersectoral collaboration to really stand something up that isn't quite so intensive and expensive as some of the other programs and services that we're trying to launch. And so the second example I want to share is something that we are launching in 2026. And this is an answer to the complex capable care piece that Daria showed on the continuum that she was talking about. So what we're noticing in our system is that there's a very high intersection of the young people in our shelter and supportive housing in terms of their child welfare involvement. Almost all of them are involved in child welfare in some way, and about 50% of the youth in our long-term supportive housing programs are in the care of child welfare or are on a visa or some kind of RSG agreement. And there's increasing pressure, so there's a bunch of things happening at the same time. There's increasing pressure in the child welfare sector to not have young people in unlicensed care homes, which means if there's a number of young people who are in the care of child welfare and under the age of 18, and they need a placement, they actually can't live in our supportive housing if there's too many other youth living in the supportive housing that are in care, because that's not allowed. So those youth will end up in for-profit care homes. As Daria said, and the quality of care in some of these homes is incredibly low, the cost is incredibly high, and it often means that these young people are moving out of the community. And what we were seeing at Wyndham House when we looked at our intake data, particularly around our shelter and long-term housing programs, is that those young people then ended up back in our community after several placement breakdowns in our emergency shelter, in unsheltered homelessness, in human trafficking, in really unsafe and problematic situations where their needs were absolutely not being met. So on one hand, our absolute focus and as much of our attention as possible is always going towards prevention. There are some young people who are in care and they need a safe place to go that meets their needs. And so Wyndham House was fortunate to be able to receive some funding to build a new supportive housing program. And so we're working on that build right now. And so we were able to take a building that was previously providing that supportive housing and sort of dedicate it for this new purpose. So we have kind of it's a congregate style home that our agency has owned for many years. And we are going to renovate this space and create 6 beds of licensed care for young people who are in child welfare as a homelessness intervention. And so this has been a really interesting kind of divergence for us because we, in the past, of course, have not provided licensed care, but we've been caring for the same young people in the same way. And so this opportunity is going to allow us to provide support to young people sooner, so the age range will be 14 to 18. It will be funded by the child welfare sector, which means we will have all the housing stock we have now, plus this new opportunity for some young people. It's going to be designed with a significant focus on youth facing the most complexity, so it will have supports in terms of mental health and substance use. Wyndham House has a health hub that has a number of healthcare providers that work in a team-based care model, so young people have access to that. We are going to renovate the space to make it incredibly robust and conducive to supporting the population. And we are going to integrate an FNS model from day one. So a big part of the focus of this program will be family and natural supports. Because again, I think right now how the sector often deals with this is there's a huge focus on family and natural supports from a prevention lens, but then once young people actually are in care, if they're living in, for example, these for-profit care homes, there's not a focus on reconnection to family or natural supports. So we're hoping to sort of break down those barriers, bring families into the setting, bring young people to their families, embed them in their community, and have supports that continue throughout their care journey. So as you can see, this kind of summarizes and sort of wraps up a number of things we've been talking about. It provides more housing stock. It provides complex capable care for those who need it. There's a focus on FNS and permanency. And it is designed for a population whose needs are not being effectively met in hopes of providing better outcomes for that population. So we're really excited about that model, and you can do it too. If you're in Ontario, I don't know what it would look like in another province, but it might be possible there too. And then our next kind of phase and our next kind of venture after that will be to think about how we do more integration in our family and natural supports and prevention work. So like I said, both sectors are really thinking a lot about this and recognizing the importance of this, and we're doing it separately. So the CAS has kin care models, and they have like an early help plan, and they're working on all these pieces. And we've introduced family and natural supports program. We have a worker that's funded through Reaching Home, but we aren't doing it together. And so I think in our future vision, there will be probably one team that does that work together. So when people are getting referred to child welfare, rather than them coming into care, there's this team supported by both Wyndham House and child welfare that will support those young people from an FNS perspective. Okay, so through all of this work, we're seeing that we are able to address a number of directives that we've received from different levels of government and for both of our sectors. So this is allowing us to enhance our prevention efforts through coordinating our systems. It's helping us improve outcomes for young people, and we're also improving, and this is sort of language that supports some of the provincial efforts right now. So Daria is complying with requirements to have placement opportunities for young people that are licensed. And we have enhanced youth voice and relational permanence. So in our Suffolk model, we do have a youth advisory committee of young people who have been through the child welfare system, and they are being compensated as policy advisors in helping us build this model. And it's providing efficiencies in both the homelessness and child welfare system, because likely the quality of care will be higher and the costs will be lower than what a lot of these programs currently look like. And really increasing that sense of shared accountability. So it's not, the youth that Wyndham House works with, or it's the youth that child welfare is working with. These are the same young people, and we need to be accountable to them across these systems. Okay, so this was originally proposed as a workshop, but it's a shorter time, so we're going to try to do a little bit of a workshop activity. So everyone should have a handout, or if you don't, I believe Darren has a few extra right there. And so this handout is a summary of our presentation, but on the last page, there's an opportunity to reflect on policy and funding intersections that exist in your community, so that you could think about how you could more effectively collaborate with another sector to provide more effective support for young people. Sorry, I see you have your hand up? Or you just wanted to? Okay. So I'm hoping that everyone can find a partner or just someone sitting near you to discuss. And I'm hoping that in 10 minutes you can come up with, identify a relevant policy intersection, an opportunity, think about how you'll overcome barriers and constraints to achieve the shared accountability, and come up with at least one small tangible action that you're going to walk away with from today. 10 minutes, go. We're shortening it to 7 minutes because we've gone over time.
But we know you got it.
We're like,
Yeah.
you can do it.
I'll go down there.
And then I think you can choose to answer for here or there for the Q&A, whichever you want.
more minutes? Yeah. And I think probably. I'll ask people for one or two examples of something they're going to do. And then actually, it's right now. I got one. Yeah. 1 minute. 1 minute? Okay, and then you do the. Yeah. I used it somewhere else. Oh, I used it in my. Oh yeah, I used it somewhere. Okay, I think I'll bring him back. Okay, we're gonna bring it back. I'm sure that was not quite enough time to solve both the youth homelessness and child welfare sectors problems. But I'm hoping that someone is willing to share one win or takeaway that they're going to bring forth after this conference. Does anyone want to share their idea?
Hey, Kristen. It's Lindsay from Safe Haven Youth Services in Kitchener. I think one takeaway is really interested in this partnership. We work really closely with our local family children's services and share, again, same youth and such. So very interested, and I like how you brought together your two strategic areas to make it one. So taking this paper home with me, yes.
Awesome. Great. Do you have, you look like, oh, right here.
Sorry, sister, I turned my back on you. Turn around.
That's okay.
Sorry about that.
No, that's okay.
I'm Robert Doucette. I'm a 60 scoop survivor. My grandparents were taken away. My wife was taken away. My children are the first generation not taken away. So, Ontario, it sounds like nirvana. But I as an Indigenous person, I'm having a problem believing it. I am. I'm sorry. Because now we've got a new generation called the Millennium Scoop. And so that's the next generation that's going to be homeless. We see it already in Saskatchewan because we're dealing with it. So my question to you is that how are you working with First Nations and Métis groups? How are you working with them? Are the youth primarily Indigenous, or are they non-Indigenous? Are they newcomer Canadians? And there was one other question I wanted to ask. If I can come back to it, I'll ask it. But it's I'm sorry if I'm sitting here a skeptic because let me give you an example. In Saskatchewan, I ran a friendship center, and the provincial government of Saskatchewan said they weren't doing birth alerts anymore, where they were where they had nurses phoning social services and abducting Indigenous people. We sent my daughter and two of her friends to the hospital. They stood in front of the door. Social services came there. I phoned the executive. No, I phoned the chief of the FSIN. He phoned the minister. And finally, the social services people left. So I know this is kind of a long-winded story, but these are the things that concern me because it's still going on. And I know what it was. It was Bill C-92 with the new child welfare as it relates to Indigenous. How are you all working this together? And I want to thank the pavilion for listening to my rant. I'm skeptical. Really I am.
Absolutely. And we should be skeptical, and this is definitely not solving all the problems, but there's several answers, I think. Do you want to start, Daria? Yeah.
Yeah, and I think being skeptical is okay, and asking the question is great. So really appreciate your question. What I didn't tell you in the beginning is that I've been working in child welfare for, I don't want to tell you, almost 31 years. And so I'm very familiar with the harm that has happened as a result of the system that I represent. And continue, absolutely. And I'm not going to tell you a tale that isn't true. In Guelph and Wellington, we have a very low number of children in care at any given time, anywhere from 48 to 55 kids in care. And we probably only have around we have around 65 kids who are in that 18 to 23. So we're seeing our numbers go down, but we still have overrepresentation in our community as well. We do have an amazing relationship with Indigenous leaders locally who have actually been working with our agency for over 20 years. And the benefit of that is that when we aspire always to connect children, youth, and families with their culture and their community, with Indigenous leaders and Indigenous traditions, and to not bring those kids into care. And if you gave me another hour, I could talk about another initiative we're doing in relation to that, but I don't have another hour today. So, is it perfect? It's absolutely not perfect. Are there still challenges and difficulties with the system? There's absolutely challenges and difficulties with the system. And child welfare is just one of those systems where there's challenges and difficulties. I think what Kristen started off by saying, like, there's tensions. Of course there's tensions. We haven't stopped talking to each other yet, but certainly we've had to have some prickly conversations at times. But our approach is, I have this memory of Kristen saying, but we can solve this, right? Like, we'll solve this. So I think it's in the approach, in the commitment to the purpose, and in the acknowledgement that it's not perfect. And we just strive to do better every day than the day before.
So how many of the children are actually Indigenous in your program?
You're going to ask me that. I don't know the exact number of children. Our overrepresentation is lower than the province, so probably somewhere around 9% related to children in care. So that's 2, 3 children in total, but when your end is smaller, your percentage changes and all those logistical data points. But that doesn't matter. I think at the end of the day, we don't want any Indigenous children in our care. We don't want to be bringing Indigenous families to court. We want to be returning Indigenous children and youth to their community. I mean, that's what the 9 child welfare commitments towards truth and reconciliation really mean. So 1 child is too many, is too much. So we continue to, we also know we're not the only system that's impacting that outcome. And so that's why the integrated approach is so important. Yeah, and I'm happy to chat with you after.
Yeah, and we'd love to hear your ideas because I think one of the biggest challenges with particularly the Suffolk initiative that I talked about is that we know the legacy of foster care and care is really poor. And it continues to be, like, the outcomes are very bad, especially for Indigenous and Black youth, right?
Can I say one more thing?
Yeah.
So when you leave families alone, when you leave Indigenous families alone, I'm sorry, can I brag a little bit?
Yeah,
Just
go
about my family. When you leave Indigenous families alone, when you don't abduct them, when you don't take them away from their family, My eldest daughter is the Grand Chief of the Assembly of Manitoba Chiefs, Kyra Wilson. My second daughter is a registered nurse. My third daughter is a physicist, and she works at the synchrotron in Saskatoon. And my wife has her degree in economics, commerce. I'm the stupid one in the family. But I'm just saying, you know, this is what happens when you let people run their own business. And I'll say thank you to you because, you know, I am a skeptic. So thank you.
Thank you for sharing that. It's so important. And anyone who's thinking about how to work with within the child welfare system and within that intersection needs to seriously consider those pieces and continue to work with Indigenous leaders and local communities to make sure that the design meets the needs. Just to be clear, this program would not be taking any youth into care, right? They're already in care. And for me, I think the challenge that I've faced in our homelessness sector for many years is that the young people, if they don't have a care option, then they end up in an emergency shelter or with unsafe people. So that's the, I think, tension that we're trying to deal with, but we're building a model in the context of a very broken system. So it is not perfect. You should be very skeptical, absolutely.
Thank you. We're going to switch. We're going to move to another presentation, but if there's time at the Q&A, you can definitely ask more questions. And as both our presenters said, please find them over the next couple of days as their presentation resonates with you and questions continue to pop up. So our next presentation is on cross-collaboration across our vast nation. So it's on Upstream Canada, an initiative through the Canadian Observatory on Homelessness and Away Home Canada. My name's Tanya McCagarty. I think I didn't say that at the beginning. She, her pronouns, third generation Canadian from Treaty 7. And my colleague, Jackie Son from COH, as well as we have Cherie Campbell from Boys and Girls Club of Okanagan in Kelowna, and the lovely Melissa Power from Choices for Youth in St. John's. So we are from one end to the other with the two pit stops in Alberta and Toronto. So we're going to do a little bit about the process or our journey along upstream. We're going to talk a little bit about the model, the data points that we've collected from our two lovely sites, and they're going to go into a little bit about what implementation looks like from them, as well as sustainability. And then we'll move into a Q&A as well. And I guess we're using both mics.
Thanks very much, Tanya. Hi, I'm Jackie Son. I'm a researcher with the Canadian Observatory on Homelessness, and I'm very honored to lead the research and evaluation on Upstream Canada. I'll try to be brief because I'd love to hand it over to our community leads who have the more interesting parts of this presentation. So if you're new to Upstream, just a general overview, Upstream Canada is essentially a prevention-focused initiative with an early intervention approach. It focuses on youth ages 12 to 14. And the way it works high level is that the students they have the opportunity to participate in a universal assessment called the Student Needs Assessment. And then we at the COH, our team assesses the outcomes and taking on a multi-tiered risk approach, we flag risk for homelessness and school disengagement. And then students are then connected with and provided with an opportunity to connect with supports, focusing on strengthening protective factors. And it's underpinned by this model that you see here. You see equity foregrounded. It's really a result of collaborating with the education sector and aligning priorities. And so this model has really done a great job getting the education sector on board and really enthusiastic about participating in something that aligns with their priorities as well. And then you see here the importance of the research practice cycle. So it's really been such a great collaborative process between education, community engagement, and within the community, cross-sector collaboration. And so it's a model that is continually evolving based on learnings through a research and community engaged approach. And this visual just kind of depicts here the levels of collaboration. So we're actually involved with an international community of upstream implementers. This model actually originated in Australia, where they've shown huge reductions, 40% reductions in youth homelessness, which is quite outstanding. And so there's now a whole bunch of countries taking this on, including the United States taking a bit of a pause, but they've been one of the original countries: Wales, England, Scotland, Belgium, and I think Austria now. Tanya, am I right? Yeah. So it's quite exciting to be able to work with this international group, learn that we have a lot of common challenges and also opportunities. We work closely at the community level. As I mentioned, we've developed the assessment in collaboration with community, with youth, with lived experience focus groups as well, and then continuous adaptation at the implementation level. So we have a national community of practice as well. So we're continually learning at the national level from our community partners and trying to pivot and adapt as we learn. Why school? So we know based on research that people with lived experience have said overwhelmingly that an ideal place where there could have been intervention would have been at the school, because it's the one place that they've regularly attended. And we know that school, so access to supports, knowledge about where to go for support, and identification are huge gaps in terms of supporting youth at risk of homelessness. And so we know that at school, that is a place where we can capture students and provide opportunities to give access to the student needs assessment, so that if all the students are participating, the stigma problem is mitigated against, privacy is protected as well. Over to you, Tanya.
Thanks, Jackie. So as Jackie mentioned, we want to, of course, get to our experts. So a little bit about the Reconnect. Both our school-based models, Upstream Canada and Reconnect, follow the same implementation guidelines. I would encourage you to go to the Homeless Hub that has both those models on there, as well as a 3-hour training on both school-based interventions that will explain and lead you through these core principles. Just want to note at Way Home Canada and the COH, we do operate from the roadmap to end homelessness, and this area focuses on number 3, again, moving upstream. And then, as you can tell throughout the continuum, our Housing First for Youth is kind of the last stop where we hope that we can support youth before moving into homelessness. And you will see family natural supports, as both our colleagues mentioned, as a key element, neither as a standalone program or infused through each one of these interventions. So all our interventions are grounded within the core principles of Housing First for Youth. Again, I encourage you to go to the Homeless Hub to spend more time with each of these, but within our school-based interventions, upstream specifically, there's 7 key features that we have learned from our folks here, as well as other 3 sites that are operating Reconnect. Working with younger youth, again, from that age of 16, and then some of our sites are starting as young as 11. Our site in Hamilton, Nawassa, who is solely Indigenous focused, has now moved to age 11. Recognizing moving upstream and supporting families before that breakdown occurs. Enhancing school engagement, partnering again where kids are at, as well supporting them to re-engage in their community and finding champions within that building. So again, removing barriers to education. Strongly enhancing connection to FNS. Again, that approach, resolving conflicts at school before they begin, whether that be original family, found family, or again, those positive role models and adults in a youth's life. And keeping them in place. As mentioned, a lot of our youth have to travel to receive emergency services. So this puts that intervention in the building that they are commonly in and in their community. and stabilizing, of course, their living situation. So we don't ever want to move in without the support to stabilize living family or living situations. And then building awareness and enhancing stigma around youth homelessness. This one this is a new feature based off our data points, where a lot of our sites were saying we're doing this work. We're working with schools, we're doing PD days, we're creating groups within the schools to actually talk about whether it's coming from the lens of youth homelessness or equity, about what that looks like in the building. So we wanted to ensure that people that are working within this model recognize that as a key feature, as well as working across multiple systems. So again, the folks will share with you that they can't be all things to a youth and their families. So how do they use and leverage their community to create that circle of care? And what do those case consults and case management look like, ensuring that they have all the pieces from the community to meet those goals?
So our demonstration sites are Kelowna, BC, and St. John's, Newfoundland. And really what we wanted to do when we brought this initiative, was brought over to Canada, we wanted to work with these communities to see how we can adapt from Australia, because we know that a program transfer approach is not ideal. So they're both mid-sized cities. In Kelowna, this initiative is led by the Okanagan Boys and Girls Club. They're a lead community-based organization. They've been implementing since 2021 with 2 middle schools. They've expanded to 3, and there's a spectrum of moderate to high risk. And then in St. John's, Newfoundland, they've been implementing with the universal approach since 2023, although they've been doing a lot of great work leading up to that. The lead community organization is Choices for Youth. They also work with 2 middle schools, and they have done a pilot with a rural school for 1 year as well. So together they do represent how early identification and school partnerships and community supports can operate across rural, urban, and diverse contexts. To date, there's been well over 3,000 students who have been screened using the Universal Student Needs Assessment, and around 34% have been identified across the multi-tiered risk spectrum. And we have seen, although educational disengagement is not causal for youth homelessness, it's strongly interrelated and correlational. And so, for example, the bottom quintile, so a lot of the students who were demonstrating low educational engagement were also at risk for homelessness. So far, and I don't know if this number is completely up to date, but my latest data says that 561 students and families have received supports through Upstream so far. And a key insight with all this data so far is that even higher risk students who are technically displaying signs of educational disengagement are actually motivated. So motivation is not part of their disengagement. It's usually related to life circumstances and external context. And so it's such an opportunity for schools to get involved. So we really do see the case here for bringing education on board as partners. And so from what we've learned in Kelowna and St. John's, these communities really do reflect a lot of the issues that any community across Canada deals with. Housing unaffordability, poverty, youth vulnerability. They have been exemplary in terms of demonstrating strong readiness and partnerships with the education sector, and as well as a commitment to engaging with us researchers in an evidence-informed approach. And so we're trying to learn from these communities on how we can scale upstream and serve different communities better. We know that there are a lot of needs and groups that we have yet to work with to understand better how to serve them. And so, the work continues, and I'll just hand it over to Cherie.
Hi everyone, my name is Cherie. I am one of the Youth Services Manager at BGC Okanagan, formerly known as Okanagan Boys and Girls Clubs. where I oversee the Upstream program. Today, I'll just quickly talk with you about some of the questions that we get asked a lot, like how we get started, why our organization was chosen as the lead organization. BGC Okanagan, we operate the only youth-specific shelter in our community. And we just were seeing very alarming numbers of like youth access in our shelters. So in 2020, we had over 39 youth access our shelter and accumulated, I think, 440 nights they accessed. And that's a really high number. So we know as an agency that we had to do something different. So Kelowna had a journey home strategy to end youth homelessness. So the stars sort of like were aligned with how we wanted to shift our work and this journey home strategy that the city has. And then Upstream Kelowna was named one of the top 10 priorities of the city. So from there, we would have like community design labs. So we'd get our community partners together, the city of Kelowna, just get everyone involved, talked about Upstream, what the community needed, and kind of like went from there. The community just identified because of the work that we were already doing, which included shelter diversion, which was our first go at prevention work. And so the community decided that because we were already doing the work going in that direction, that we would be the lead organization. So like I said, Kelowna had a journey home strategy, which one of its core pillar is prevention and diversion. We had implemented shelter diversion as a program already in most of our programs. And so we really were working hard to shifting youth from out of homelessness and shifting them back to their family and natural supports. We know what was important for our community is that we had a program that was able to address those or identify those risk factors in young people from early, which is what Upstream does. When we do those assessments with our grade 8ers, we're able to catch those risk factors from early on and just wrap them around with supports, which was really important for our community, is having a program that not only focused on just housing, but also mental wellness, education, and family supports. So how we got started, so BGC, we provided like investment in leadership to launch Upstream. Again, our community design labs to help build trust and understanding and get the local buy-in from our community. We had consulted with Raft Niagara, which was an agency in Ontario that had seen some success with prevention work. The school district, which was key, we did have an ally who would help us prep for board meetings and just how to get approval, make sure we're working within school policy, and engaging our parents of the middle schools. That was really important as we'll be working with their kids and making sure that they understand what services we're providing, the work that we want to do and how important it is for a community. And then we partnered with local agencies to provide that wraparound supports just because we are a big agency. However, we do know there are other agencies in our community who provide support in areas that they're the experts in. So we partnered up with those agencies. And our commitment was to also find funding for those agencies that would take part in our program. And we started off with one program coordinator, one caseworker, and one school. And then we moved our way up into, we currently have 5 case managers, one program coordinator, and a manager. And we are expanded in 3 middle schools. So for partnership with the school district, we wanted to make sure that we keep our focus on our shared goals, which was reducing school engagement and supporting graduation outcomes. So again, maintaining that trusted relationship with our district ally by giving them a seat on our steering committee. We adapted our assessments to meet the trends of what schools were seeing. We'll go over like our evaluations after our assessments to kind of like work with the schools on trends that come up and offer programming to support any trends that come out of those evaluation. And then funding. So funding is always a big question. Again, because this was one of Kelowna's top priorities, we did have a lot of investments from local funders in our community, and we also did have some federal funding as well. So we had a few foundation in Kelowna at the time who our goals aligned with theirs, and we did get some good funding for a few years from them, so that was really great. And just for the year 2024 to 2025, we conducted 5 assessments across our 3 middle schools. 1,276 students completed assessment. 399 students were identified with risk factors. 156 students signed on for support. 80 of those students were students that were flying under the radar, which we might not have identified had we not done the assessment, which could be ADUs that could have fallen through the cracks have we not had this programs. So this is one of our participants that graduated from the program, and her quote was, "I used to think that as long as everyone else is happy, it doesn't really matter how I feel, and I just kind of push my mental health behind and went focus on other people's, which I think is important to a certain extent, but I need to put myself first because I'm going to live with myself for the rest of my life. Because of Upstream, I no longer think this way." Then again, some of our participants, and this is just a quote from our educators. So BGC partnered up with an impact and evaluation organization because we just wanted to see what impacts Upstream was having in our community. And so we interviewed 9 educators, surveyed 20 participants, and did interviews with 15 participants and then 4 guardians. And so this was one of the quote from our impact evaluation results from an educator. I would say that the happiness level is higher, that the mental health level is like students know where to access supports if they need it. The mental health piece is the big one. The anxiety, the stress levels are lower, and then if they do heighten, then they have their person to contact, or they have a resource or strategies to use, which is what we want. We know that there will always be crisis in life, so we want to just give them the tools that they're able to manage those things as they come. And just one of the feedback that I always get from educators is that Upstream has provided them to be able to do what educators are meant to do, which is teach, and then we take care of all the other stuff that comes to support the kids. And I'll hand it over to you, Melissa.
It's a good note to hand it over on. All this stuff.
All righty. Hi, folks. My name is Melissa Power. I am the program coordinator for Upstream in Newfoundland, Labrador. Currently, we are running out of St. John's and Mount Pearl. So a little bit about our project. We are located in St. John's. Started in 2020, but as Jackie mentioned, we didn't actually do a student needs assessment until 2023. And our goals, of course, are to reduce homelessness and increase school engagement. So why Choices for Youth? So Choices was founded in 1990. And it was first a shelter for young men and gender nonconforming individuals. And many of the programs that have developed over the years at Choices have been in reaction to the needs of the youth. So we've had some really great innovators over the years that have thought, how do we get to these issues before they become crisis? So that is where we had to shift in the way we work. So we aim to be preventative with the Upstream program and said, where can we reach kids at an earlier age? Essentially, every youth that is homeless was once in an education system. So let's start there. However, it took some time. But we had so Choices was our lead agency. We had the support of our researchers at Away Home. We have great relationships with our health services, and we had money through the federal funding. So when we approached the schools, they were like, oh, this is going to be another one of those projects. It's going to cost us time and energy. And we said, it's going to cost you nothing. We just need to work together. And again, we can take all the things that are on the side of your desk, figure those things out, and you guys can get back to teaching. So our current model right now, we are in 2 elementary schools, and we have our whole program, we have more of a reconnect model in a high school, but it's because we have youth in the junior high that feed into the senior high, and we continue that wraparound supports as they move, as they grow. We have a backbone team of administrators, healthcare professionals at Choices, and we have small caseloads, so 10 to 12. I like to keep it closer to 10 and less if possible. Because we're not only supporting the youth, we are supporting the families as well. So for our particular project, students can get involved by doing the student needs assessment. They can get referred from their teachers, guidance counselors, friends, or they can do a self-referral or drop-in. And then everything we do is youth-led. It's completely voluntary. So when young people come to our office for support, it's because they really want it. We're not asking any questions that they don't want to answer. It's totally fine. They identify who the people in their circle are, what types of supports they need, and all they need to do really is engage. So our program, so we, as I mentioned, we follow the family natural supports model, and connection first is one of the core principles. So we are physically in the schools. These are a couple of our offices that a lot of great work happens. And of course, youth and family are at the center of everything we do. So if a young person is identified either through the student needs assessment and we do a check-in with them, or if they are referred by a teacher or guidance or admin, we would then work with them and their families to see what their individual needs are, because of course we want to keep the family unit, however they identify it, supported so that they can be supported long after we're gone from their lives. And this is just some activities, some pictures of activities, and some of our participants. And I don't know if you can read that, but this is a dashboard of our resources and our interventions that we've had from January to this month. So if anybody wants that more clearly, I can certainly expand on any of those areas. And, whoops, and that's the end of me. The next one's shouldn't be there.
You sure?
Nope. Did that once.
Perfect. That's
you
the end of us. Whew. I just want to say that Jackie and I have had the honor of working with both of these organizations for deep dive with them over 2 years. And I want to say this was a really lovely presentation, and they deal with very complex youth in their communities. I would say St. John's, and forgive me if this is incorrect, is dealing with years of generational poverty in a tight community. And Melissa and her team create a space in school where those kids normally don't feel safe, or their parents don't believe that education is of use or of quality from the interviews that Jackie and I have done. And they have found that success in Upstream. It's been really motivating and enjoyable to work with both of these groups, and same with Boys and Girls, BGCO in Kelowna. And they're doing a good work. They work closely with their Friendship Center and the Mental Health Center to make sure those connections are made, as well as the housing support. So I just wanted to give kudos to you in this public space, because it's been a delight to learn from you. If there's any questions on either presentation, I am here to walk around.
Hi, thanks so much. My name's Claire. I'm from Justice for Children and Youth. It's a legal aid clinic in Ontario. So I just was struck by the slide that said the program is youth-led. And it's wonderful that the young person is like the decision maker and is really driving the process. But is there any tension with working with the school and the family and the young person in terms of, I'm thinking about confidentiality, or where you might find yourself feeling a bit conflicted between, and like how does the program manage that?
Yes, there's tension.
Yeah, I'm sure there is.
Always. Yeah, so we do our student needs assessment with grade 7s. And of course, we need consent to work with them outside of the school, outside of the school setting in the community. So we need to get parents or guardians on board. It just needs to happen. But at the end of the day, if the youth is not buying into this program, then we're not getting anywhere. So we just need to be creative in how we, for the most part, the fundamental goals are the same thing. And they want something different or something better. So it's just our approaches to how we're supporting that young person. We're family is everything for what we do, however the young person defines it. So if we can't necessarily support the family, we're looking for other organizations or other services that can. And I mean, we're embedded in the school, we're in their circle of care, but their relationships with us are a little bit different because we're not teachers, but we're kind of in their space, and we're there to really hear them and really listen. Not that teachers aren't, however, this is our purpose, is to be there, and the teacher's purpose is to be in the classroom and teaching. So for a lot of young people, they just maybe haven't had somebody take the time to listen to them. And oftentimes it's just translating that with the parents or the teachers to make sure that their voices are heard.
Cool. Thanks so much.
Good afternoon, everyone. Thank you so much for a great presentation. My name is Rona, and I am from the Canadian Mental Health Association in Thompson, Northern Manitoba. And so for me, my main question is, you just put up a slide here and it said your main intervention area was actually mental health. So I have a two-part question for you. And this is for everyone at the table, as a matter of fact. In your respective areas, how have you found the correlation between mental health and you haven't put programs in place or supports in place with that, and then by extension, the other issues are being addressed because you're the only one that presented the data, so I can see mental health. But in what you're doing in Wellington and Guelph, and what you're doing in Kelowna, what are you seeing it in terms of mental health? That's number one, and its correlation with the other issues that are there. Secondly, I join with our colleague here from Saskatchewan, where I am not seeing the involvement of the Indigenous peoples. Now, where I am from, that's the vast majority. So how is it that this is being incorporated in research? Because what you're doing with Upstream is research, so I would love to hear more of the incorporation of the Indigenous way of life into the Upstream model, if it has been included, but it's somehow not in the presentation here. I would really love to hear more about that, because these are the peoples that we support, and if we can catch a vision of how these great programs can assist the peoples we support, then we can help to take this vision back to our region and say, okay, how can this work for us? So for everyone at the table, I just need to understand, again, great presentation, but how are we incorporating how we support the Indigenous peoples and their way of life into getting these great results? Thank you.
So as for the Indigenous supports, speaking for Kelowna, we do have a Indigenous specific case manager on our team that support our Indigenous youth. We also continue to provide continuous training for other case managers, so they all understand what it means to connect a youth to their culture, because that's a aim of ours in Upstream, is to make sure that the youth that we support feels connected to their community and to their culture. So we do provide a lot of cultural supports. We do have strong connection and collaboration. Like, we work really closely with our Indigenous department in the schools as well, and we continue to strengthen and build those relationships. We attend Indigenous workshops, and just like we work really closely with the family as well, as that cultural and community connection piece we do know is really important.
I can answer from a research perspective. So when we were first considering working on Upstream here in Canada, the understanding was that because this model belonged to Australia and we're adapting it here, we were trying to respect and honor the fidelity to the model. And when we were initially beginning with Kelowna and St. John's, we didn't know what the demographic makeup would be. It's been such a big learning journey. We've had some really great emergent learnings, especially from the Indigenous case manager. We did have a lab that included Indigenous partners, and they vetted the approach, especially because it's privacy protected. The approach is supportive and voluntary as well, but we know that there are big gaps, so I think it's become clear to us, because we know about students who self-referred after trust was built over time, and heard that some of them were not comfortable being honest on the assessment, which is totally understandable. So it started to become clear to us that we probably need a different approach, an adaptation. But even from there, we've really pivoted to say, okay, rather than an adaptation of Upstream, we probably need to start from ground zero and engage more with our partners and say, well, this is the goal for Upstream. What is the best way to move forward with Indigenous communities? And so we really are on this new learning journey. We've applied for some public health funding to explore that, but we do understand the need to have our Indigenous communities take ownership of this and learn from them on how to do this better to support the students.
Okay, so to answer your first question about mental health, I would say mental health is a factor 100% of the time, 99% of the time for the young people we support or their families. And I agree with you or suggestion that addressing the mental health need is often one of the most effective ways to prevent an experience of homelessness for that young person, especially where there's family breakdown, where perhaps the family's struggling with the unmet mental health needs of that young person, or perhaps intersecting with the parents' mental health concerns. So yes, it's an incredibly large factor. And certainly at our organization, when trying to access traditional mental health services in our community, it was not as easy for the population that we were serving. And we actually brought on more internal mental health providers that were focused on this population and really focused on complex, capable, low barrier models of care. And that really helped us to be able to more effectively meet the needs of the population from a mental health perspective. From an Indigenous-led service perspective, in Guelph, it's a small Indigenous population in Guelph, but it is overrepresented in both homelessness and in the child welfare system. We have different groups, different service provision groups that we work with depending on that young person, right? So if they're Métis, then there's a Métis group that we work with. There are some multi-service agencies like Southwestern Aboriginal Health Access Center, and they have workers that will work alongside and really lead like the support plan for that young person and their family, and help us build relationship with the family and provide connection to culture. And really, we're sort of taking that supporting alongside role where we're providing access to housing where it's requested or other types of support. So I would say that's mostly how it's working now. But I think the other really important piece we need to do in our community is to build capacity for Indigenous organizations to provide more support. So that's something that we are actively working on, I think, as a group of leaders in our community, is how do we support those organizations so that they have more capacity to support their own young people and families where possible.
And I'd just like to add that family and natural supports is a Western concept. So we're building upon Indigenous learnings already with family and natural supports. We're taking the colonial speech about it. So often when we work with Indigenous organizations, we say, we know you know this. This is our Western society that now uses this language to work with youth and your youth, unfortunately. But to this gentleman's point at the front, we know that Indigenous, if those children weren't removed, they would be taken care of through a natural family and natural supports lens. So we fully want to respect the Indigenous worldview within FNS. So our Nawasa partner in Hamilton, which is the only fully Indigenous organization that has taken on a school-based intervention, they're using FNS, but they're using their own language. So they've taken their own community and their own elders to decide what FNS looks like. Again, the model may shift, it may change the language, but again, at the essence, it runs through all the programs. One more question, I think we have time. Okay, two. Unless you need to leave, you can leave.
Thanks. Thanks very much. Thanks for the wonderful presentation. James Hughes with the Oberoi Mission here in Montreal. Welcome everyone to Montreal. Wonderful to have you. My question is about Upstream Canada's impact at the community level. So we've seen school level data, but I'm just wondering if it has perhaps in other countries where it's been implemented, and perhaps in your sites as well, any community level impact. You were mentioning that your shelter numbers were up in Kelowna considerably. Has Upstream had an impact on your shelter numbers or youth incarceration numbers, or any, as I say, more community level impact in the communities where it's being tested?
For Kelowna specific, I can say like our numbers for youth shelter has significantly gone down. I think over the last month we had only one youth in the shelter. I do note that is in part with like our shelter diversion efforts as well. I am not sure if it's directly related to Upstream, but we have definitely seen a reduction of youth access in our shelter for sure.
I would like to say yes, that it has improved our communities. In working with the feeder high school, we've had many of those teachers say that their grade, so their grade 9s, we're in junior high, their grade 10s are just different. They're like, I can't explain it, but I feel like it's upstream. I'm like, I don't like to take all the credit, but they have more understanding of supports, what they need. They're better advocates for themselves, and they're impacting their school community. They're impacting those around them. So I would like to say that it is having a positive impact on the community, and I think that years down the road, and hopefully we can continue this great work, we will see a shift in the data. But I have, I feel it in my heart that it's making a difference.
That's such a good question, and I think with prevention work, it's always the most difficult thing to prove, right? So prevention programs are always so easy to take up because it makes a lot of sense, but then to sustain it is another story because we can't always show concretely that this initiative is leading to XYZ outcomes, but we are going towards that. It's only been a few years now, so we're hoping that, I mean, Australia does have, out of all the countries, Australia is really the only one with longitudinal data. So if you look Upstream Australia up, they do have published reports on more long-term outcomes as well. And so we're aiming towards that to link administrative data across education and shelters. So that's our next big project, hopefully.
I'm sorry, we're at time, but I'm sure any folks, if you have burning questions, will stay up here. I'm just making you stay for another 5 or 10 minutes to answer any individual questions. Thank you so much for spending your afternoon with us.